Now, everybody responds to drugs differently. Many factors, including body size. I have been taking aspirin for 30 years. I take 325 milligrams. Most aspirin is dispensed in 81 milligrams. Now, I'm not going to give Gordon Klett 81 milligrams, but I'll give 81 milligrams to these three ladies sitting across here. I think that a 200-pound man and a 100-pound woman are not the same. And so 81 for the small and 325 for the big. That's the way I look at it. You can look at it any way you want. No. To continue. Many factors, including body size, genetic makeup, age. We don't absorb, we don't digest, we don't excrete as well as now as we did when we were 35. The consumption of food, the presence of one or more chronic diseases, the presence of tolerance or resistance to a drug. All of these have to be taken into consideration when the drug is prescribed. The idea that an average dose, one size fits everybody in the room, is fallacious when you consider all these variables. So prescribing for a particular patient, is the art of medicine. What to give the person that you're looking at, not what you're going to give to the next 50 that walk in the door. All right. Tolerance to a drug is a person's diminished responsiveness to the drug as the body adapts to the drug's presence. Examples are sedatives, narcotics, and alcohol. Resistance to a drug implies that a microorganism or cancer cells have changed or developed defenses against the drug which was previously effective. Dependence may be physical or psychological. There's a difference between tolerance, dependence, and addiction is a compulsive use and an overwhelming desire for a drug. Now, let's take a few moments and we'll talk about drug reactions, side effects. And these are unwanted, unpleasant, noxious, or potentially harmful effects. One adverse effect is the exaggeration of the drug's therapeutic effect. For example, you take an antihypertensive drug and you get an excessive fall in your blood pressure. Well, you don't want that because that can cause you to faint and to fall down. Or you take a drug for diabetes and your sugar goes down below the normal level, you become hypoglycemic and you collapse on the floor. Type 2 adverse reactions are unpredictable. These include rashes, jaundice or liver damage, anemia, kidney damage, that kind of thing. Allergic reactions are due to genetic differences in the way each body metabolizes or responds to a specific drug. Mild reactions, upset stomach, headache, fatigue, muscle aches, change in sleep patterns. Moderate reactions, skin rashes, visual disturbances, urinary retention or incontinence, mood changes, or bone marrow changes. Serious reactions are life-threatening, such as liver failure, heart rhythm disturbances, or kidney failure. Mild or moderate reactions require a decrease in the dose or changing the number of doses in 24 hours. We're all getting older, and doses should be as small as possible to do the job which you want done. That's why I've said over and over again, it's a course of trial and error. The doctor establishes this protocol. He puts you on it. Come back and see me in 2 weeks. You come back in 2 weeks, he assesses the situation. He makes changes, he doesn't make changes, he raises it, he lowers it, he stops it, he tries something else. Come back in 2 weeks. Until you've established a pattern of what works for that patient in what dose. And then you're going. Then you can say come back in a month, 2 months, 6 months, whatever. But it's all trial and error. And everybody is different. Everybody's not the same. Okay, Now, I want to go to this sheet that I gave you. And I'm just going to read it over because I think it's simple and basic, and I think it's easily understood, but I think it's important. Because elderly patients often suffer from multiple chronic diseases, they must be given special consideration when determining what medicine should be given and in what dosage. In general, elderly patients use more drugs than any other group. I take 9 pills myself, and I'm pretty good shape. But I take 9 pills.
That's why you're in good shape.
No.
I take more than that.
Yeah, and I'm sure most of us take more than I do. That's what my doctor tells me. I do what he tells me to do. The following principles should apply. The physician must know all the medication, both prescription and over-the-counter that the patient is taking. Many patients consult and are treated by multiple physician consultants. It's not uncommon. You go to your family doctor and you have this particular problem, and he sends you to the gastroenterologist who checks you over and says, you got to go see the liver guy because you got liver damage. So there you got 3 doctors right there, and then you may have surgeons get involved. The worst is the hematological oncology people. They have all kinds of results. Psychiatrists nowadays are not talking doctors. Psychiatrists are chemists. You go to a psychiatrist with a problem, you get a pill. We have all kinds of wonderful chemicals, and they don't talk to people anymore. They just pass out pills. All right.
Is that cheaper?
It's cheaper in the manner that it's faster. It's much easier to see 4 patients in an hour than it is to see 1. If you're going to talk to somebody, you need an hour. You see, if you're passing out pills, maybe you can see 4 if you're good. The dosage schedule should be as simple as possible and should be self-administered. All instructions to the patient and the principal caregiver should be in writing. Everything should be in writing. Anything oral is quickly forgotten. Patients should be followed closely for compliance, drug efficacy, and adverse effects. If you're having an adverse effect, you've got to tell your doctor about it. Any physiologic or pathological changes may affect the dosage or response to the drug, and these must be considered, such as changes in gastric acidity or intestinal motility, because this can decrease stomach emptying time and delay absorption. It's well known that absorption of nutrients, vitamins, minerals are all impaired in the elderly. On the other hand, increased intestinal motility may not give enough time for absorption if you have diarrhea. And then the ratio of fat to muscle tissue is increased as you get older, and this can affect the distribution and accumulation of fat-soluble chemicals. Now, nutrition is extremely important in older people, and nobody's going to operate on you without doing the serum albumin. If your serum albumin is below 3, they're going to say, go eat some and then come back when it's high enough that you can heal. Any surgeon would cut on you with an albumin of less than 3 is looking for wound problems, big wound problems. So you need to keep your serum albumin above 3. Protein, eat protein. Let's see, reduction of hepatic enzymes in the liver. If that occurs, then your liver, which is the detoxifying agent of your body, is not functioning with its usual efficiency. The elimination of the drugs by the kidneys may be reduced in the elderly, particularly because kidney function gradually decreases as you get older. Fortunately, we have a huge reserve. And unless your filtration rate gets down below 30, you're okay. It gets down below 30, you're heading for the dialysis. All right. And finally, elderly patients are more sensitive to drug effects, especially narcotics. And said, if you use a much smaller dose in older people than you do in younger ones. Narcotics, sedatives, tranquilizers, some diabetic drugs, diuretics, and many others. Now, I brought a couple of things with me. First thing, I've got time. First thing, Wednesday, November the 7th, the UT the Union Tribune. Anybody see this article? Humana and Walmart committed to your health and your pocketbook.
Yeah.
They are going to give you any one of these 10 antihypertensive drugs for 1 penny. Nice.
And what are you supposed to do with them?
Yeah, what do you do? Of course, they're only going to charge you $18.50 monthly for the planned premium, which comes up to $222 a year. Now, these 10 drugs are antihypertensive drugs, and they are several groups of antihypertensive drugs. The treatment of hypertension requires multiple medications because there are multiple causes for hypertension. The common things are diuretics. Get rid of excess salt and water. Diuretics. Hydrochlorothiazide, microzide, triamterene hydrochlorothiazide, which is diazide or maxide. 2 out of the 10 are diuretics. Then we also combine the diuretics with beta blockers. Beta blocker blocks the epinephrine put out from your adrenal gland when you're under stress. And it causes your pressure to go up. And they have atenolol, which is a beta blocker. And they have metoprolol tartrate, which is a beta blocker. And they have nalgolol, which is a beta blocker. And then there is ACE inhibitors, ACE inhibitors, angiotensin converting enzyme inhibitors, angiotensin converting enzyme, ACE inhibitors, of which they have 1, 2, 3, 4, 5 different ones, all for a penny apiece. This is exactly what I'm talking about a protocol or an algorithm. If you're always going to treat hypertension, start off with a diuretic, add a beta blocker. That didn't work. Person had diabetes or kidney trouble, add an ACE inhibitor. And this is how the doctor thinks, and this is how the protocols are written out for them. But I thought this was interesting, since we're talking about medicine. We could also talk about insurance and why they're doing this. Humana is a big, big company. Okay. Now, aside from the doctors, I mentioned their education, their medical school, their residency programs, their practice programs, when there are salaried doctors working for medical groups or companies, and they're being told what to do and how to do it. That's nice, but the doctor still has some freedom of picking between 1 or 2 groups, but in general, he's told what to do. Anyway, here's a 1,300-page book, Current Therapy, comes out every year, has everything in it. If the doctor isn't told what to do, he can read about it. Okay? I've showed you this before. A copy is in the billiard room downstairs for anybody who wants to look at it.
Doc, you mentioned albumin a little while ago. I don't know what you're talking about.
Albumin is you have 2 big proteins in your body, albumin and globulin. Albumin is the protein which builds muscle and is absolutely essential for healing, building muscle, replacing things that have been destroyed or worn out. And so,
What do I do about it?
what do you do about it? You eat your fish. That's good enough. Everybody else will eat beef like me. So you fishes, and any protein, chicken, fish. That's why you have a protein with every meal. But anyway, there's a copy down there for everybody wants to see this.
How do vegetarians get it?
Vegetarians, there is protein in certain vegetarians, like legumes well, it's vegetable protein. But animal protein is much, much better. But they get by. We've got a couple of vegetarians. They do.
I'm not a vegetarian.
John Moritz is. Look at him. He's been here, what, 20 years? 20 years. Fantastic. Then every doctor has their physician's desk reference. Now this book has 3,000. Let's see.
Did you read it fresh every year?
I know every word on every page. Did you know that? Oh, it's got about 3,500 pages, weighs 10 pounds. It's also on the internet. And a doctor doesn't need to look at this book anymore. This was my Bible when I was practicing. Doctor, he can go on the internet and get his drugs, boom, right now. Works.
Providing the doctor knows how to go.
Copy of this is done.